Hey James, how's that side of the knee pain?
What side of the knee pain?
The outside side of the knee pain.
Oh, that outside side of the knee pain. That hurts.
Join us on the 50 Shades of Pain show. We're talking about knee pain on the outside part of your knee. Welcome to the 50 Shades of Pain show, where we empower our community with knowledge about pain, both physical and emotional, to give you the tools that you need for optimal health. I'm Dr. Donish, medical director of Wellward here in Lexington, Kentucky, and I'm here with my co-host.
On this beautiful day, Dr. Escaloni is here with you.
I know, it is a gorgeous day. Humidity is low, what, 75, 80 degrees?
That's gorgeous outside. I love this.
It's beautiful. It's the perfect time to go jogging, right?
Mm-hmm.
You've got knee pain.
Yeah.
And the knee pain that I'm talking about is the type that's on the outside part of your knee. I don't know if you can see that, if it's in the frame or not.
Well, right up through here. Hopefully you see that. The lateral or outside part of the knee, it's a big problem for people who love to do a lot of outdoorsy things like running.
Yeah.
So why is that, Dr. Donish?
You've got 4 bones that support the knee, or that make up the knee. We always think of it as 2 bones because we got one sitting on top of the other, the femur, which is the thigh bone, and the tibia, which is the calf bone. But you've also got 2 other support bones that help the knee move. One is the patella, or the kneecap. The other one is this lesser recognized little bone called the fibula. And it even has like a tiny little sounding name, fibula. When I was a kindergartner, true story, I wanted to impress my sister because I could jump up a stair, like I could skip stairs. The moment she came and I tried to show her, flat on my face. And I actually broke my fibula. So I could walk on it. It just hurt. And I remember my teacher said, well, just walk it off. And I could. So I thought, I'm fine. But of course, if I went to play or did anything that had me pivoting, couldn't do it. It would hurt. And they've discovered I had a broken fibula.
Wow.
So your fibula is a very unremarkable bone that's actually key in creating knee stability and allowing you to pivot like I am right now. It creates that rotational motion at that calf and ankle, but it also is a foundation for your hamstrings coming in and a bunch of other ligaments and tendons. So if you have any kind of sprain or injury to that fibula, whether it's chronic ankle sprains or injuries to the upper part of your knee on that outside part, you can get chronic outside of the knee pain.
And this is actually really important if people have had chronic issues otherwise, like places like your ankle or your SI joint. And if people are saying, oh, I've got other issues on the side of my knee, like IT band syndrome, things like that, all that attaches there.
Yeah.
And all those other structures need that little fibula bone to be able to do its job well.
So it's a really important bone. The other structure that people always talk about on the outside part of the knee is the lateral meniscus and the lateral collateral ligament. Those are less common than the medial meniscus and the medial collateral ligament because that medial side, one, takes more stress, but it's also the meniscus and the ligament are actually attached to each other. Now, what are meniscus and ligaments?
I think that's the structure that you squish when you stand on the meniscus.
Kinda. You don't squish your meniscus. It's like a ring around that tibia, the calf bone, that acts like a cup in which the femur sits and moves. When you're rotating or if you're tilting your knee, the meniscus is what keeps things in place. It's a figure 8 ring that includes your ACL and your PCL. These are common ligaments that people hear about, like I tore my ACL. Well, that has a lot to do with stabilizing the meniscus. So a lot of times when people have catastrophic injuries to the knee, they're injuring the meniscus, the ACL, all of that at the same time, and often on the inside part of the knee or the medial side. Like if you've got if this is left knee, right knee, medial is on this side, lateral is on the outside. So medial is more common, but people can still injure the lateral meniscus and the lateral collateral ligament, which supports the motion of the meniscus or the lack of motion in the meniscus.
I've often seen these over the course of my career. If people have had a lot of bad ankle sprains, if their ankle seems a little bit loose or wobbly afterwards, well, the spot on your ankle that is often injured is the ligament that attaches to the fibula bone. And if you hit one side of that bone, the other side of the bone is going to be affected somehow. Especially most people with ankle sprains, they recover pretty fine. It's just a little bit wobbly. So that just means there's going to be a problem a little bit further up with dealing with that wobbliness at your lateral knee.
So if you've ever had ankle sprains, or if you have outside of the knee pain, that lateral side of the knee pain, by all means, come and let us get it checked out, because a small problem today could translate into a bigger arthritic problem down the road. And a lot of these things are very preventable, very treatable.
Absolutely. And we can help you not only with any sort of exercise recommendations, exercise changes, any sort of amazing qualities of options that we offer here at Wellward, including prolotherapy if necessary, things like PRP, different types of progenitor, like things like bone marrow aspirate concentrate, all those things that can do a whole lot of great non-surgical orthopedics to help you out. You should check that out.
If you found this helpful, please check out our website, wellwardmed.com. Leave comments, because we always read them and we try to cater to what information you're looking for. But otherwise, find us on our iPod, iHeartRadio podcasts, and
This is on Spotify, iHeartRadio, iTunes,
all
or
our
our
podcasts.
50 Shades of Pain show, our podcast. It's great.
Well, thank you everybody for joining us, talking about the outside knee. And until next time, I'm Dr. Donish.
I'm Dr. Escaloni.
Take care. Enjoy that jog.